In this week's episode of Horses Explained, I am joined by equine vet Sarah Coombs. We will explore how the horse's heart and lungs work together to keep all the other body systems working, and how to promote cardiovascular and respiratory health through our management. So Sarah, thank you so much for joining us today. We're going to be talking about the cardiovascular system and also the respiratory system of a horse. We're lucky to have our Bailey here, who's wearing our Bailey's Feeds rug, which obviously shows some of his anatomy. When we're talking about the cardiovascular and respiratory systems, what are we referring to?
So we're basically talking about the heart, which is very prominent here obviously, and the major blood vessels. And the major blood vessels subdivide and become very small blood vessels. So we have arteries that leave the horse's heart and take oxygenated blood around the horse's system. And then we have veins that bring back blood that's had the oxygen taken out of it. And the actual interchange of oxygen and carbon dioxide happens at the tiniest blood vessels, which are called capillaries, and that's what's right at the periphery of the horse underneath the surface of the skin. So that's the essence of the cardiac system. The respiratory system starts at the horse's nose, and the horse only breathes out of his nose. He's not a mouth breather. Comes up here, the larynx is about there. This is the windpipe, the trachea comes down here, and you can see on this diagram the lungs are basically protected by the rib cage, so that the lungs are here. And a horse is a supreme athlete, which is why humans have developed so much the relationship they have with the horse. So they have proportionately a very big heart and a massive lung capacity, so that the horse can go from standing around to seeing a lion and the predator in the distance and going straight off into a gallop. Part of the reason they can do that is because they're so very well adapted with their cardiac system and their respiratory system.
And how are those two systems linked together?
So basically the heart is a pump, it's a muscular pump, and there are two elements to how the heart beats. In one part of the beat, it's sending blood into the lungs, and when the blood travels through the lungs, it picks up oxygen from the tiny little airway sacs in the horse's lungs. So that blood then goes up into the lungs, comes back into the main part of the heart down here, where the really powerful contraction happens that sends the blood, now loaded up with oxygen and other nutrients obviously, right round the horse's system. So that's the main link. The little tubes that are within the lungs start off like ourselves with bronchi. You're familiar with the term bronchitis. Yeah. That's the larger tubes within the horse's lungs, and they divide and divide and divide, and right at the very end of those little tubes are little pockets, little sacs, which are very, very thin walled. Okay. So those little thin walled air sacs are very close to tiny blood vessels, so that the oxygen can go through from the little air sacs into those tiny blood vessels and be taken up into the bloodstream. And then, as I say, that blood then comes back from the lungs into the heart and gets pumped out around the body, preloaded for action.
Amazing. There's a lot going on, that's for sure. And so what is special about a horse's circulatory system?
Well, the horse, compared with the human, the horse has a very interesting feature, and again it comes back to them being kind of locked and loaded, ready to run, and they keep spare red blood cells in the spleen. The red blood cells are where the oxygen lives in the blood, and obviously if you want to be a supreme athlete, you want to have a lot of red blood cells, because then you've got a lot of oxygen. And in the same way as the marathon runners go and train at altitude, part of the reason they do that is to get more red blood cells and get their red blood cells better tuned to take more oxygen. But a horse is unique in as much as there's an organ called the spleen, which lies over the stomach, and in the horse they keep a reserve supply of red blood cells in the spleen. So if Mo Farah could do that, he'd be even better than he is already. Basically that's a huge reserve of red blood cells. So when the horse is in a very intense competition, or as I say, has suddenly got to gallop away, the spleen contracts as part of the fight and flight response and squirts out those red blood cells into the circulation, and the horse has got more power and more oxygen carrying capacity. I mean, they are incredible athletes. You know, we are blessed to have that athletic ability at our disposal when we ride and compete with horses.
Incredible. And then in terms of exercise, what effect does that have on our horses' cardiovascular and respiratory systems?
So when you exercise, same as we do, the normal resting heart rate would be about 30 to 40, depending on how fit the horse is. Sometimes we have very fit endurance horses that have a heart rate of 26 or 28 in the stable. So with exercise, the heart rate goes up, the respiratory rate goes up, because obviously all of the things we're describing have to happen at a faster rate. The heart beats harder and stronger, as well as more rapidly. And you can monitor that, and you can monitor the horse's fitness by the degree to which the heart rate goes up and the rate at which it comes down again.
Okay.
So basically you're talking about speed and intensity.
And as a horse owner, are we able to measure, and look at what our horses, respiratory rates are, or what their heart
Very
rate's
much
going like?
so. And it's a really useful thing in the general care of your horse if you're just familiar with what is normal for your horse. As I said, some very fit horses will have a resting heart rate of 28, but your horse is averagely fit. Somebody like Bailey's probably got a resting heart rate of slightly more than that, because he's not quite as fit, perhaps. So it's really useful to know what is normal for your horse, and you can listen to the horse's heart with one of these, which is easy to get off the internet.
Yep.
It's easy to use. There's nothing difficult about listening with a stethoscope. And if we just move Bailey's beautiful rug for a minute, this is the horse's elbow, and you want to be listening just behind the horse's elbow.
Okay.
So that's really easy to do, and it's like any other skill, you just take a bit of time to learn where it's loudest. You can hear it on the right side as well, and when the vet listens to the horse's heart, they will listen to both sides. But in terms of testing a heart rate, you put your stethoscope on, you time 15 seconds on your watch and multiply it by 4.
Perfect.
So the sums are the most difficult bit. And you can also feel the horse's pulse up here in the same way as somebody will feel a human pulse on their wrist, or you can feel it on the inside of the front leg as well. So you can do that. When it comes to listening to monitoring the horse's breathing, you will notice when you go into a stable and a horse sees you, it changes the way that they breathe a bit. They're in anticipation maybe of going to the field or being fed or something. So it's a really good trick to learn, if you've got a horse that's stabled, is to look from the box door before you actually go in. Just stand back and watch the horse's breathing, and it's kind of easiest about here. So watch how the horse's flanks are going in and out, and a normal horse will breathe at a rate of around 12, 15, 8, that kind of range, and it should be regular and even and steady. And again, if you get used to looking at your horse and how your horse breathes normally, it's really useful if you start to wonder if something's not quite right one day. If you can say, well, I've got used to looking at him and normally his respiratory rate in the box is 12 per minute, so now it's 16 or 20, then you might think maybe there's something going on.
Yeah, I agree, and I think the importance of knowing what is normal
Definitely.
for our horses is critical. When we have horses come in new to us, or whether they've been returned from loan, we take their temperature, pulse, respiratory rate, and we know that on arrival they are going to be slightly tense. Their breathing patterns, heart rate might be slightly increased, and so it's just making sure that we do things at regular intervals and just sort of working out what's normal. It sounds so simple.
Yeah.
But actually, we would want that for ourselves. We like to know, you think, oh, I don't normally feel like that, or my heart rate just doesn't really go up that much when I go running, but it's so important for our horses as well. And so then in terms of our day-to-day management, why is it so important that we consider our horses' cardiovascular and respiratory health?
Well, particularly their respiratory health, the way in which you manage your horse can have a big impact on that. I mean, relative to humans, we don't see, sure, things happen to horses' hearts, but principally, in my day-to-day work as a vet, I see more horses with respiratory problems than I would for heart problems. And in terms of their respiratory health, you can do an awful lot to maximise your horse's respiratory health by the way in which you keep them. So you want to start off with the very best hay you can afford. And that doesn't have to be, particularly if you've got a cob or a pony, I don't mean the hay with the most high nutrient value, but the best quality. So, you know, don't be afraid to pull it out and sniff it and look at it, and you may think you're not an expert on hay, but you know, if you smell it and it smells nice, it's all right. If you smell it and it doesn't smell nice, it probably isn't all right. And it's as simple as that, really. So you want good quality hay that's not dusty. Ideally, you feed everything on the floor. So the horse has a very clever system, immune system, that it's working inside the airways as well as the sort of antibodies that are in the blood, so that there's a system for moving out particles that get into the horse's airway. And that works better if the horse has got its head in what is a normal position for a horse, which is its nose is down there and its lungs are up here. So obviously if there's stuff to drain out, it'll drain out better if the horse is eating off the floor, and ideally outside as much as possible. So we've got the best quality hay we've got fresh air, and fresh air is a really important commodity for horse health. And in terms of grazing and being outside, that's pretty obvious. In stabled conditions, it's something you really need to focus on consciously. So we talk about horses being on dust-free management for certain problems, so they will have haylage instead of hay, they'll probably be on shavings or one of the straw alternatives, but they have to be clean, and you have to assess for yourself whether the air is good quality, whether you can smell anything nasty. And it's also really important, if the horse is on bedding, to get down at the level of the bedding and see what it's like at that level. So we're here at World Horse Welfare, and we've got these beautiful crew yards, which are a fantastic environment for horses, and we've got straw bedding, but we've got masses of fresh air, and it's very good quality straw, and it's shaken up before the horses come in, so it's not dusty, and that is probably a much healthier environment than if the horse is on shavings that haven't been mucked out properly, and there's urine soaking in there. And basically, if you can smell ammonia coming off the horse's bed, that's a toxic level of ammonia sufficient that it obstructs this airway clearance that the horse does naturally. So again, trust your nose. You know, you may not think you're an expert in anything, but actually your nose is going to tell you an awful lot. And if you get down near the horse's bedding and it smells bad, it is bad. And I fully appreciate that, you know, not everybody's lucky enough to have crew yards, and if you keep your horse on a livery yard, you're given a stable quite often in a barn, which isn't ideal. You have to work with what you've got, and I absolutely understand that. So the more you can have the horse out, either grazing, or if your grazing is restricted, particularly as when we have the wet winters and stuff, get your horse out and take it picking grass, or take it out in hand, even if it's not being ridden, on a regular basis, because it's really important the horse has its head is out of that air environment and able to get its head down.
And that's the thing, it's about emulating what they would, you know, experience in nature. If we weren't domesticating them, they would be down grazing. That's what their body wants, that's how their body needs to function, and we shouldn't try and change that for them. And I completely agree with the smells and having the access to, you know, the best air and the best feed as well, because I've got a horse who has asthma, so everything is right. Okay, this I have to manage, and you know, making sure that he has. I've just moved from a crew yard type setup to a stable, but I've given him the biggest stable that I possibly can, and I limit the time that he has inside as much as I can. You know, he lives out 24/7. He comes in for grooming, handling, riding, and that's it. And I don't want to do any more than that, because fundamentally it's his health that matters.
So it's really key, the environment that we have the horse in, and obviously you have to make the best of the circumstances you've got, and ideally it's nice to have the horse out 24/7 like you say you have with your horse, but you can do the best with your environment if you just look at it critically. And some barns that you go to, we can all visualise where you walk in the door and there are bins with feed in and kit in, and there are rugs hung everywhere, and the whole area is dusty and a bit grotty, to be honest. There's no airflow. So it's really useful to just stand back and look. And if you think the horse has a massive lung capacity, so they're breathing out an awful lot right down to these very tiny airways we were talking about. And so if they're breathing in dust and mold spores, then obviously a little bit of that gets right into their airways and can very easily make them ill. So it's a really good idea to have a bit of spring clean where your horse is, and once a year try and get in there and get rid of all the dust and hanging straw and nasty stuff.
No, I completely agree. I know that, you know, we make sure that we give our barn a pressure wash, you know, every so often, because the reality is we do get a lot of dust build-up. That's a nice stretch. And we don't want that for our horses, even though, you know, we have got a nice open American barn. We don't want to be enabling that, you know, dust build-up over time. And it's just being realistic where you can, and just applying principles that really we would have for ourselves and our own homes.
Yes.
You know, you don't want to be sitting in your living room where everything is built up and, you know, you don't have access to your windows and things like that, or your sofa smells. If we wouldn't have it for ourselves, I think it always comes back to, then why would you have that for your horse?
All of that clutter that's in the barn is reducing the actual volume of air in there for the horses to breathe. So if you think of a barn that's got 20 horses in it and they're all having to breathe and rebreathe the same air, you really want to have all the doors open that you can and the windows open that you can. And we have this bit of fixation of keeping them warm and snug, and that's not what they need. If you think they're not warm enough, you can give them a rug, but you mustn't restrict the airflow into the barn. And I think that's a really important message to take away.
No, I agree. And you've mentioned about, you know, smelling the hay and also smelling the bedding. What is a horse's sense of smell like? You know, we've got this big lung capacity. If we can smell it, does that mean that it's even worse for them?
Yeah, very definitely. They have, obviously, their sense of smell, much more than for us, has evolved so that they can distinguish poisonous plants and you know, things that are hazardous. So that, yes, definitely, if you can smell it, it's at a toxic level. Particularly with ammonia, that's, well, and as I say, quite often I will go into a stable that looks beautiful and say the horse got a problem with its foot. As soon as you squat down near the horse's leg, you think, oh boy, and sometimes the ammonia is coming off in waves. Well, you think the horse is lying down with its face there, or it's eating its hay off the floor and it's eating its feet off the floor. Well, and if they're in that stable for 20 hours a day, or worst case scenario, 24 hours a day, then that can definitely impact on their health in terms of their respiratory health. And quite often with horses that have low-grade respiratory disease, they may not even be coughing. What you will quite often see is a horse with a mucus nose, which will either be watery mucus or it'll be thick, yellow, grotty stuff. Hello, sweetheart. But they can have mucus anywhere down in their airway, which will be restricting the efficiency with which they breathe, and they do this gas exchange before they cough. So quite often there's a lot of people will be thinking my horse is fine, it's not coughing and its nose is clean, but actually they could have mucus and nasty material in their airway, which when you're looking at a more athletic horse, sometimes they'll pick up because the horse isn't performing to expectations, and then you investigate and you find the horse has got a lot of mucus and perhaps infection, mucus and pus together in their airway, so they need treatment.
No.
So it's like everything else. As soon as you have to see the vet, it starts being expensive. The key thing is to make your management good preventative health care, so that you buy, as I say, really good forage, you keep the horse out as much as possible, clean bedding and good airflow when you do have to shut the horse inside. No,
I think those are some really important points that you've put across, and they're so simple to implement within our day-to-day management. Thank you so much. It's been really, really insightful. Thank you.
Well, I hope it's been helpful. Thank you.
I don't know about you, but I found this episode so helpful. As an owner of a horse that has asthma, it's really difficult to know what is best for them and what setup can we make sure that we're giving them to get the best out of their health. And so the tips and tricks that she's been able to provide, I hope you can take home with you and consider, are you giving your horses enough ventilation? Are you making sure that their bedding is changed appropriately, and it was really beneficial to hear the importance of taking our horses' respiratory rates and their pulse so that we know what is normal. So I'd really recommend keeping a diary or a log of that information so that you can see those trends and really notice when something is a little bit out of sorts, and you can see that potentially something is already going on before that you've given any other clinical signs. If you've enjoyed this video, make sure to click that like button. Drop us a comment down below. Are there any tips that you've learned on this journey that you're going to start to implement at home yourself? And finally, subscribe to World Horse Welfare's YouTube channel. This will make sure that you don't miss out on any of our future content and the other episodes that are yet to come.